Good day, everyone, and welcome back to our training on Advanced Basic Life Support for Prime Care Nursing Practice. In this video, we will be talking about AED and Post-Resuscitation Care. But before we proceed, let's quickly review our previous lesson. In our previous lesson, we identify OPA and NPA, and also integrate ventilations with compressions using the 30:2 ratio. Now back to our topic. By the end of this module, participants will be able to describe what an AED does and when defibrillation is indicated, identify AED parts, and demonstrate safe AED operation steps. Now let's get started. What does an AED do and why is defibrillation important? An automated external defibrillator is a device that checks the heart's rhythm and tells the rescuer whether a shock is needed. If the rhythm is one that can respond to defibrillation, the AED helps deliver a controlled electrical shock. The AED is mainly used for shockable rhythms, especially ventricular fibrillation (VF) and pulseless ventricular tachycardia (VT). In these rhythms, the heart's electrical activity becomes chaotic or too disorganized to produce effective pumping. This means the heart is not sending enough blood to the brain and body. Defibrillation works by sending a shock through the heart so that all the heart cells reset at the same time. This gives the heart's normal electrical system a chance to start working again. The AED does not restart a dead heart in a magical way. It stops dangerous electrical chaos so a normal rhythm may return. Note, the earlier defibrillation is given in a shockable arrest, the better the chance of survival. Now, what are the main parts of an AED? The voice and visual prompts of an AED guide the rescuer step by step. This is why even learners with limited experience can still use an AED effectively if they stay calm and follow the instructions. The AED is designed to guide the rescuer clearly during an emergency. An AED has several important parts that help the rescuer use it correctly. These commonly important of AED include the power button or lid sensor, voice prompts, visual prompts or display, electrode pads, pad cables, the shock button on some models, the battery, indicator lights or readiness display. Note, the rescuer should follow the AED's prompts exactly and avoid guessing. Let's quickly look at the correct steps for using an AED. The use of an AED should follow a clear order, which includes the following steps. Step 1. Confirm cardiac arrest. Check responsiveness, breathing, and pulse. If the person is unresponsive, not breathing normally, and has no pulse, call for help and begin CPR while the AED is brought. Step 2. Turn on the AED, open the lid, or press the power button. Listen carefully to the prompts. Step 3. Prepare the chest. You start by exposing the chest fully. Dry the chest if wet. Remove anything that may interfere with pad contact, such as heavy moisture, excessive hair, or patches where relevant. Step 4. Apply the pads. Put the pads in the correct positions. For adults, 1 pad on the upper right chest and 1 pad on the lower left side of the chest. For children under 8 years, use pediatric pads if available. Place 1 pad on the front center of the chest and place the other pad on the mid-back. This is called antero-posterior placement. Step 5. Allow rhythm analysis. Stop compressions briefly only when the AED tells you to analyze. Make sure nobody touches the patient. Step 6. Deliver shock. If advised, if the AED says shock advised, loudly say clear and make sure no one is touching the patient. Press the shock button if the AED requires it. Step 7. Resume CPR immediately. After the shock, start CPR again immediately. Do not wait to check the pulse unless clear signs of life appear or the AED prompts a reassessment. Step 8. Continue until help arrives or ROSC occurs. Keep following the AED prompts, continue CPR cycles, and reassess only as directed. Note: AED use should interrupt compressions as little as possible. In summary, AEDs analyze heart rhythm and deliver a shock to treat dangerous cardiac arrest rhythms. Use the AED by turning it on, applying pads correctly, following prompts, and delivering a shock safely if advised. Resume CPR immediately after shock and continue until help arrives or ROSC occurs. That is it for this session. Thanks for watching. See you in our next session.